Hi, my name is Dr. Glenn Fox, one of your anatomy co-leads. Welcome to the neck. In this session, we'll discuss the cervical region, or the neck, and it's my hope to provide you with a succinct primer for this region upon which we can build a more complex understanding. The neck, or the cervical region, is the area that is inferior to the head and superior to the thorax. So here we're looking at an anterolateral view of this particular donor with the skin and the subcutaneous tissues removed. And we can see some of the deeper elements of the musculoskeletal system. Important in our study of the neck is the hyoid bone. The hyoid bone is an important muscle attachment site. So we will discuss the infrahyoid, infra means below, muscle group that attach to the hyoid bone. We'll also discuss the sternocleidomastoid muscles, which are located here, that are these thick strap-like muscles of the neck. We can see the external jugular vein, which is returning blood from the face and head down to the subclavian vein there. There are many different systems that are an important component of the neck. Here we can see a transverse section of the neck, and central to our understanding here is a vertebrae. The cervical spine forms a lot of the bony support of the neck, and it's upon the cervical spine that a lot of the neck muscles attach, as we can see some of the deep neck muscles here. We can also see those sternocleidomastoid muscles in their anterolateral location here. We can see the infrahyoid muscles here. And then working deep to this, we can see condensations of deep cervical fascia, the carotid sheaths, which are going to be surrounding and investing some very important neurovasculature of the head and neck, namely the internal jugular vein and the common carotid artery, as well as cranial nerve 10, or the vagus nerve. Medially here, we can see the thyroid gland, and the thyroid gland with its isthmus and lobes on either side are surrounding an important element of the respiratory system, the trachea. The trachea is conducting air between the larynx and the primary bronchi of the lungs. And posterior to the trachea, we can see an important element of the digestive system, the esophagus, which is transporting materials from the pharynx to the stomach. So this is a very important region for moving elements of the cardiovascular system, as well as the respiratory and digestive systems. The neck is also important because we may palpate the carotid pulse. The carotid pulse is a feature where we can detect blood flow to the brain. So the carotid pulse may be palpated at the bifurcation of the common carotid artery into the internal and external carotid arteries. The internal carotid artery is what's sending that blood to the brain. So if we palpate the carotid sheath at the superior aspect of the neck, we can detect that blood flow to the head. So we've discussed where the cervical region, or the neck, is and some of its basic components. This is your summary slide. Thank you for your time.